sure Russ agrees with me, and most physicians I know do, that breastfeeding is the ideal way to feed an infant. It's the food that nature has designed to be best. It's better than any formula or any substitutes. There are so many advantages to breastfeeding. Breast milk conveys immunity from the mother system to the baby in the early part of life. It's the ideal mix of nutrients. That's apart from all the psychological effects of breastfeeding for both infant and mother. So I recommend breastfeeding, at least for the first year of life, and then probably as long after that as you feel comfortable.
I agree completely. Breastfeeding, first of all, is a wonderful way to bond between mom and baby, to actually imagine that the mom is actually providing the nutrition so that her child can grow up as healthy and strong as possible. Is a wondrous, wondrous thing, and almost indescribable. And I used to tell my wife I was somewhat jealous of her that she was able to do that. But beyond that, just as you spoke about, actually breastfeeding can actually help prevent certain illnesses of childhood, like eczema and recurrent ear infections and things of that nature.
Probably not just childhood, probably throughout life as well.
Yeah, I was going to say, because there's some discussion about preventing certain cancers and things like that. And then for the mom, there are health benefits too, because it's been shown that breastfeeding can help prevent premenopausal breast cancer and things like that. So very, very important to lay that foundation. And as you said, the nutrients, the immune factors, and for at least a year, that's what we say we recommend. By the same token, though, I think you would agree, there are certain moms that cannot breastfeed because of medical conditions, or it's just not working for them, or they just really don't feel that it's right in their situation. And we don't want moms to feel guilty about that. We want them to understand it's what works for your family. And there are very good formulas out on the market. It's just that the preference is for breastfeeding.
So what would you recommend to a woman who has to stop breastfeeding for one reason or another before the first year of life?
Well, certainly the first thing is, to be kind to themselves again. It's not that you're a bad mom. There are certain times that things happen and we can't continue doing what we might want to for the entire first year, including breastfeeding. So one of the things we recommend is looking for a good form of formula. We prefer organic, if at all possible. We prefer formulas that have DHA or fish oil supplementation to try and help with central nervous system. We're looking also to make certain that they're being exposed to formulas that don't have toxins in them, or that they're using feeding methods that don't have toxin exposure as a possibility. We think that's critically important because the environmental exposures early in life can have significant impacts later on in life.
And I would also say it's important to shift to formula rather than cow's milk at that time. And furthermore, I usually tell parents that if one or both parents has a family history or a personal history of allergy, of asthma, bronchitis, autoimmune disease, it's very important not to expose the baby to cow's milk in any form before at least, I'd say, 2 years of age. It might be longer than that, but if you wait that long, then you might be able to introduce cow's milk and cow's milk products gradually without problems. But I think if it's introduced too soon, if there's that genetic potential, it can set a child up for lifelong problems.
I agree, whether it's frank allergies or sensitivities. And so we almost always recommend that they hold off on pure milk products until a year of age. Earlier than that, there's even some micro bleeding and things like that that can occur with milk, and so we're very, very cautious about that. And then certainly we hold off on introduction of other foods that might cause problems too, even early in life. And so the nutritional aspects that we take with us throughout adulthood really start during that infant period.
Do you want to comment on other milk substitutes? I know that I usually recommend soy milk as the best alternative because it has a protein content similar to that of milk, and also you can buy forms of it that are fortified with calcium and so forth. But I think people should be cautious about things like rice milk, potato milk, milks that are made from starches because they don't have the protein content.
Absolutely. I couldn't have said it better.
Okay, good.
And I would also say that with regards to soy, there are some people who are concerned about using soy during infancy, because it's got estrogenic effects. Could the children have premature maturation of sexual organs and things like that? And there's actually some pretty good data out there following kids for over 30 years who were raised primarily on soy-based formulas during infancy, and they had no significant differences from their peers.
Actually, I feel quite comfortable about recommending soy because I think the main health benefits of soy are starting it early in life, especially for prevention of breast cancer in female children. It influences the development of breast tissue up to puberty and makes it resistant to development of cancer. And I suspect we'll find the same thing for prostate cancer.